Hi, I'm Dr. Naysha Isom. I am a board-certified family medicine physician, and I am here with my co-host.
And I am Tammy Hernandez, clinical professional counselor specializing in autism and ADHD. And this is
Neuroreal. So we're going to discuss how autism isn't the problem and actually the system is. So we'll get started with a little bit of our backstory, explaining our why. We'll start with me. And the reason for this podcast is because I found out late in life that I am neurodivergent. I used to think I was just highly gifted with ADHD. And then I recently found out that I too have traits of autism, which explains a lot of my behaviors. So, that, along with some personal hardships that occurred with my former husband, who was very autistic and again undiagnosed, has led me to revealing that autism really isn't a problem. It really is the system. And so tonight I want to start off in that vein, and we'll discuss more, but let's also talk about Tammy's why.
Yep. So I am also late diagnosed with autism and ADHD. So ADHD is the new acronym that we have, I guess, and came to this realization just a couple of years ago when my doctor diagnosed me with ADHD, and yet this is what I do for a living, right? And so I missed it in myself, which often we can do. And so we really just want to kind of spread the awareness, right? I raised two ADHD kiddos that are now adults, and why I always knew that was for, something for them, that diagnosis. I missed it in myself, and that is happening a lot for parents. And so we just wanted to kind of bring this to light a little bit more and make it a little more real and understanding to people who might be confused about it.
So essentially, this is our lived experience, right? Both diagnosed late, both professionals. It is both now our specialties and a true passion for us. Like, I also am a mother who's also dealing with a child who is perfect in every way. But again, still with the highly gifted traits, the autistic traits, and the traits of ADHD. So we're gonna move into our first segment, and we're gonna start talking about what autism is and what it isn't. Part of that will also be what we were trained to believe it was. So we're gonna actually start off with what I believe to be the real expert when it comes to autism, rooted more in the counseling and the psychology side of it. So Tammy, let's start with what autism is.
Well, I've always said it was a developmental disability or disorder. A lot of people don't like the way that sounds, but it is the reality of it. But it is an individual experience, and each autistic person is different. There's not enough understanding. So even for myself, when I was doing my psychology undergrad, I wanted to know what autism was because there were so many stories about, it's the mother's fault, or it's mom's doing this wrong, and I thought that can't be the case, right? And so I ended up doing an entire presentation and paper and everything, and really opened my eyes to these are just challenges that people have, and their strengths that people have. But unfortunately, we're highlighting all the challenges, and we're highlighting the deficits, and we're forgetting about all the strengths and all the things that make it beautiful to be autism. And so that is something that in my practice, we really focus on, is helping people learn to accept the way they are, not feel like they have to change who they are to fit a societal standard or expectation, and just understand that autism doesn't have to be this ugly thing, and it doesn't have to have all these real sweet little labels that we can accept and be afraid of autism, because autism is a beautiful thing. And yeah, we do have some challenges sometimes, and we may have some, things that are harder for us that we have to have accommodations, or you say accommodations, I say self-care, depending on the environment, what we're doing. But it's really not about the person having to change their behavior, but about the world and society having to change to help us, because we're not really the problem, right? This is something where autism is not the problem. It's just a way of being. And it's time that we kind of break the stigma on what autism is and recognize those systems, whether it's the medical field or the counseling field, that we need to change that. And that's something that you and I are really set out to do at this point, realizing they're not teaching this stuff in school. And that is not an understatement. I literally got a little excerpt in a book about what autism was. Nobody said how that was going to translate into counseling or even in psychology. What does that mean? And it's been, thank goodness for all the real experience that I had. And now I can reach my clients through that experience. But it's a journey for me too, to even know about my sensory issues and all of those things, and be able to translate that for clients, and, having to have training programs and all of these things. And so change has to happen. And if it doesn't, we're going to stay in the same stuck state that we are. And people that are autistic with ADHD or any kind of neurodivergent, which I don't necessarily like that word. It's hard for me to throw it out there, but we all have different things that we like or don't like, or what feel good or don't feel good. And so we have to accept that in everybody and just kind of, work through that. But it's not, autism is not one label that fits everybody, and every label that is being created to explain autism is also equally frustrating.
So you said a lot there. So I want to break a few of those things down, because we're going to have some disagreements. So it's going to be fun.
I know. That's the way it works.
Which is, again, it's beautiful. So I'm going to play devil's advocate a little bit, because again, reading some of these things out there and again, I have clients the same way. The majority of my patient base is very neurodivergent, again. So this is where we disagree, right? I like the word neurodivergent. And we'll talk about why I believe in that terminology a little bit more, but I still believe in the traits of autism, ADHD, and those of highly giftedness. So we'll get into that too. But for those people who do have, more challenges with their autism, right? So we can sit here and say, we are two professional women who have autism, ADHD, and are both highly gifted, right? That doesn't seem like it's a problem to some people, right? Where they may have children who are actually having more deficits and more challenges, and to tell them that it's a beautiful thing or that it's okay, right? That those parents are struggling, right, with children who are not doing as well developmentally, right? So what do we say to them? Because it is a spectrum, right? And you're going to have people who look like us, and we're going to have people who have more developmental challenges, right? I don't personally believe they're one and the same, but what are your thoughts?
So I think that sometimes there are different cognitive abilities. And I think having raised two children that are absolute opposites on that spectrum, highly gifted at times, not highly gifted at times, I've watched it fluctuate. I've watched it change. I've watched my children have these developmental challenges at different stages of it. So even highly gifted, my son is highly gifted, and yet he was my nonverbal autistic who at 8 months old was slamming his head on the ground, which we would term self-harm. No 8-month-old is going to choose to do that, but I watched his anger get to be so much that he couldn't control that. Then I've also seen, when my grandson was born, I knew from day one that he was autistic, and nobody understood that, but it's because I watched that in my son. And I watched how that baby cried nonstop. My son was the crier who cried 24/7 until I wanted to rip my hair out, who was sensitive to food, but the doctors weren't picking up on that. And I didn't know until my grandson came. And when I saw him, I thought, okay, I think I know. Probably sensitive to iron. Let's get that. And we were able to adapt these things. But I knew from then because I already watched it. Whereas my daughter was highly gifted very early on, not developmentally challenged or behind in anything, super ahead of in talking and all of these things. And then I watched her cognitive ability struggle when she went into school. And it's that kindergarten and first grade that autistic kiddos are struggling in school. I thought super highly gifted. She was reading Black Beauty at 4. Mm-hmm. But then putting her into school where it's no longer one-on-one, there's other kids there, she started to struggle. And so her challenges, it was hard.
So here's the only thing I'm going to say about that is that, and we can get into the whole gifted thing too, but so she never stopped being highly gifted, right? So it's not a thing of like they stopped being highly gifted, right? Yes, IQs can change, and we can talk about how we measure IQ and all of that, but it's not that her IQ changed, right? It's just that her environment changed, and so again, behaviors change where her IQ does, and so how one performs in school has nothing to do with their IQ. And I think that's where oftentimes we don't necessarily see the highly gifted aspect in some autism, right? Especially because they're in certain environments that don't allow for that academic behavior to be seen, right? My husband was that class clown, so to speak, right? But a very highly gifted person. Like he went through school straight C's, and his family was like, he was essentially like the dumb jock all his life. He really didn't know until like we were married, right? He didn't know. Like he didn't even believe me when I was like, hey, I wouldn't have married you if you weren't. Like, I can recognize this in other people, and you're highly gifted as well. He didn't believe it until again we got our daughters tested and so forth. So highly giftedness, and I'll just go out there and say it now. Like I believe like all highly gifted people have traits of autism and ADHD. And that's why I still use the term neurodivergent, because you're gonna have traits. Sometimes you can move towards the middle, depending on how you're socialized or what therapies you go through. You'll move towards the middle so that you can assimilate and acclimate to normal society, if that's what you want to call it. But at any given moment when life presents its challenges, you're going to be able to see those traits come out, and they can be pathologic at that time. And so, again, for me, neurodivergent brains, right? Highly giftedness, we know can be, again, that's why it's neurodivergent, because you can be amazing up here, IQ greater than 130 here, and that joker can jump down to 100 for something else, right? It's going to be kind of like what I call a heartbeat, right? You're going to be up and down and not chronologically the same across the board. And so it doesn't always show up in academics. So that's a poor way of like determining, right, if a person's highly gifted. But that highly gifted brain, for me, is that neurodivergent brain for sure, and it's going to have traits of both, right? And so even though she just started to show more of her autism, it sounds like, right, once you put her in a school environment.
Yes and no.
Okay.
So I look at it as, so where you say highly gifted, I say cognitively enlightened. And I have purposely done that, as we've talked about in the past, because some of us that would be considered highly gifted, it's not a gift. It can be very challenging. And when you are cognitively enlightened, these are, as a kid, as a young kid, you're seeing the world in ways that's bigger than anybody could imagine. How could this kid possibly think of these big world problems and get so depressed that we can't solve them? That's cognitively enlightened, right? But saying highly gifted, or what people term as, some others will say, okay, high functioning, Those are, levels of accommodation are actually the functioning. That's a misconception that people have, the functioning part, right? Oh, our brains are so highly functioning, right? And so that's the misconception. That's where the lines get a little bit skewed. So we could be cognitively enlightened and see things that others can't and understand things that others can't. By the definition of what some autism is, I wouldn't fit into that category because I can problem solve. Wasn't a skill I always had, but I can do it, and I can do it exceptionally well, which is what makes it easier for me to help my clients. But I also have what I call superpower of being able to see down the road very quickly, problem solve an entire trajectory of something that's going to happen, and that helps me get people where they want to go and to meet those goals and figure out very quickly. Now, in this field, that works. Other fields, not so much. But in this field with counseling, thank goodness I came to it later in life, it works for this, right? But whereas I saw my daughter struggle, some of the autism traits, but then that ADHD is severe for her. So she struggled with that. But she also went into a people pleaser mode, and that's a whole other series. And I'll kind of explain what I mean by that and how that can really hinder you as someone that has autism and severe ADHD. Whereas here is my son who is cognitively enlightened. He is what we would call highly gifted. And yet he had this very slow, developmental thing going on where my own sibling would ask me, is he mentally retarded? And I'm like, whoa, why are we even, because he's quiet, because he follows you around and he observes, right? And so that's what he was doing. He was observing, he was learning, he was doing that. So even with the more severe autism that it's being labeled now, severe autism, right? Like you were talking about, I have seen all different levels, and in what I do now, 100% of my clients are neurodivergent. I've been working in the autism world for about 10 years now on different levels, whether it be early intervention, as an RBT doing ABA, which some people don't like that, but there's a whole thing that I can explain about that as long as you have people who are doing it right and not trying to suppress what you're doing, but they're helping you understand what you're doing. That's different. That's what ABA was really, should have been like what the psychologist had designed it years and years ago to help with behaviors. But anyway, so I've seen all these different levels, and I was watching a video of, a child who was nonverbal, who was hitting themselves to the point of bruises. And they are terming this child as severely autistic. And all my mind could see was this child who was having a sensory issue. And if we could figure out what that was, they're applying pressure to their body to release the chemicals they need. They're not meaning to hit themselves, but they are needing an input. And if we can figure that out and help them figure that out, then we can help them. Doesn't make them any less intelligent as other autistics. And I've said that before, that whether they're nonverbal or not, it doesn't mean they're not smart. It doesn't mean that they're cognitively low. It just means that we haven't found their communication style yet. We are expecting people to speak in verbal things because that's a society's way.
It is.
Why aren't we helping them talk to us in other ways, their way? Art, whatever, music. They're communicating in a million different ways, but we're not listening. We're not listening correctly. So I don't think that I understand where parents who are struggling with the kiddo who may be beating himself up, and society is judging that parent. Parents who are going into the grocery store and the kiddo is having a meltdown, society is judging that parent. They did it with my own child who was super hyperactive and wanted to climb on everything. And one day with me, she's climbing up the stairs and turns around, she has a black eye. And I'm like, oh my gosh, she hit something on the stairs. I took her to my parents' house for the weekend, and my dad's like, oh my God, what'd you do? I said, I didn't do anything. She climbed, right? I pick her up from his house and she got a black eye on the other eye. And I said, want to explain that to me? And he goes, I'm sorry. Yeah, she walked right into the table. I said, thank you. But when my brother and I took her into a grocery store, the looks that came at us as if we were beating this child. Right. And it was like, okay, one, she's a toddler learning to walk. You would think, okay, we're going to get that, but why are we judging so much, right? And so that's where a parent we will pull back on, take our kid, not take him to the store anymore, not this because of what society is going to think. So it's the stigma, and we can help. And that's why it's important. That's why I sought you out. I needed a doctor to help my clients. And through this, we have realized there's so much more than just the cognitive ability or the enlightenment or the giftedness or the whatever.
Yeah.
There's so much more to this, that if we can open that up and help with the inflammation in the body, in the brain, people are going to be able to use their words, but they shouldn't have to. My grandson had meltdowns all the time until I taught him sign language. And guess what? They went away because now he could communicate with his mother. He could communicate with his grandmother, and we understood him. And to watch that child's face light up, that now we can understand you. Whew, what a relief. I can get my needs met because they get it. It wasn't him that needed to change or bring those words out. It was us that needed to help him communicate with us in a way that we understood.
And I definitely agree with, we all need to have better understanding of what autism is and what it isn't, and how to recognize it early, and then where to get help. And I think, again, what we're doing, I think is pretty amazing. What we're capable of doing now, before, are things that we've not really been able to do in autism. And so, yes, it would be nice, right, if people could learn how to, meet their needs better. But also, we're at a place now in medicine, in learning about the condition, that we can actually help move them more towards the middle, right? So kind of what you do with therapy. A lot of that early childhood nonverbalness does happen a little bit more frequently in males. But we do now know, there's a lot more evidence showing that this is more brain inflammation. I know people, there's genetics, it's multifactorial, right? So anyone who wants to blame it on a medication, a vaccine, a parent, trauma, how they were birthed, all of that. I need a bubble right now. I need a bubble to pop up because I don't want to say it, but it is multifactorial. There is never a one thing, and genetics plays a very strong part in the diagnosis, right?
Predisposition. Yep.
That part, right? And it's gonna be variable. So whereas to my husband was, if you want to say high functioning, I don't like that word, we'll find a better one. High functioning, undiagnosed until his last days, right? With autism. It's not until I found out that his niece, right, is more of that pathologic autism, right? My husband, he wet the bed until he was 8 or 9, late in life, right? Again, same thing, that those early traits, right? My daughter went for a longer period of time, not as long, but again, but she potty trained earlier, that kind of thing. And so you start to recognize some of these traits that appear in autism now that we can sit back and reflect, and we understand a little bit more about what it is. And so, again, I didn't see it until I saw it in my husband, but it showed up more severe, I should say, right? If you're saying severe is the nonverbal type.
When you
early
said
on,
that originally, that struck a nerve.
Yeah.
Said it's severe, or I can't I can't think of the word that you said, but I was like, oh, because it has a negative connotation to it, as if that is a bad thing. It's not
to be nonverbal, right?
To be nonverbal.
Oh,
yes.
I'll call it pathologic, right? Because that's the thing that you see, and so, right, because you have this, new baby, everything's going great, they're walking, but then they're not talking. And I think we talked about this earlier, right? It's not we don't again, we're not really trained to recognize it until you see the pathology, right? Doesn't mean, again, I'm using like my husband as an example, like doesn't mean that it wasn't there. He had autism, right? We didn't pick up on those late potty training signs, right? We didn't like, that's not autism. Yeah. It was. Versus like though his niece, again, has like that more what we're trained to recognize, right? That's clearly autism, right? Which again, misses when we don't fully understand it. We miss the people like my husband who, again, because of his autistic traits and because he didn't understand it and because he didn't have the therapies that he needed to be able to move towards the middle, ended up committing a catastrophic event. Yeah. Right.
So here's how this gets missed in families. It's not that his case was so severe.
No, his wasn't.
It's just that, so even if we say severe, it's that we have these cultural and familial, everybody's got these things. And so we're told by elders, oh, that's just normal. And that's just typical. And we are believing that until it gets to be so severe, right? To where we go, oh, now it's a problem. But yet we've had these traits that each generation, maybe someone has something more severe, so we're going to pay attention to that one. Yet we all had those things that were challenging at different levels, but they were dismissed because, oh, cousin so-and-so and your aunt this and your grandma that. Oh, that's all normal. Right? And then it presents and we're now saying they're severe, but severe says what? That something's wrong. Something is bad. And it is more challenging, and it is, not to take away from the parents that are really struggling and the kiddo that is really struggling, but that's where society has to do better and not be like this person.
So let's talk about that though.
With that
like society has to do better because, for me now it's, society's not going to change, and to that extent, right? That's like, it's not, right? And so autism is still not the majority of the population, right? And if you look at the statistics, they'll tell you that being highly gifted, you're 2% of the population, right? Once you hit that 130 and above IQ. So it's not a large majority of the population. Yeah, it's a big topic right now. We can't, it's, for me, it's more about moving them towards the middle and helping with those pathological traits, right? I don't really care. Like, we're going to use the words, we're going to use the labels, but I don't really care about the labels at all. What I care about, and I say this all the time, is I care about the traits. Again, being highly gifted, being brought up to believe that, oh, I'm the smart girl, right? As if, again, like you said, like it was this great thing, but realizing like, there's so many other things that are going on in my head and how I'm having to adjust to my environment and mask and do all of these things.
It comes with an expectation.
To fit into this world, right? And I always say, I was blessed and fortunate enough to have the family that I had that helped me. That was my therapy, unbeknownst to me, right? That pushed me towards the middle. So I am a firm believer that therapy and services can help you move towards the middle so that you can actually be able to care for yourself and be productive in this world. Because I do believe that every autistic brain is a gift in there somewhere. They're often locked in, and we're going to talk about some of the amazing things that we can now do that we didn't have access to before. But again, if they're locked in that way and right non-verbally and again, because of brain inflammation, basically, they can get therapies do help them move, more towards the middle. And again, sometimes they get stuck, especially if the autism is that rigid kind of autism, right? Those traits that we're talking about. So for me, it's not about being neurodivergent. It's not about the label, right? That's why I use neurodivergent as this big umbrella label. It really is understanding the traits. And so we're going to get back a little bit to like, okay, what if we have to, there's some traits that I definitely say, okay, that's an autism trait, because there's a lot of blend and mix between highly giftedness, because highly gifted people, smart people, don't want to be called autistic, right? ADHD people don't want to be called autistic, right? And my journey was I was highly gifted first, because that's, you get tested early. Like, oh, you're highly gifted, throw you in the classes. Great for me. I'm the smart girl. Had all of the signs and symptoms of both autism and ADHD traits. However, I only got the diagnosis of ADHD later, and I mean like after college, after med school, basically after residency. It was like at the tail end of residency that I got the diagnosis. So made it all that way, having an understanding of that I was highly gifted. And now I have ADHD. So the ADHD then explains a lot of the forgetfulness, the absent-mindedness, my Barbie moment, so to speak. I probably shouldn't have said that. My blonde moment, shouldn't have said that either. But my absent-minded moments. And so, I distinctly remember saying around the time I was like 16, that if someone asked me to do something, I would be like, if you didn't see me write it down, then don't expect me to do it, right? That was like my motto. Like, if you list everything, checklist everything, all of those things. I didn't know that I had ADHD, even though by the time I got diagnosed, I had already been trained to diagnose and treat ADHD, but I didn't recognize it in myself.
Just what happened to me.
Yeah, so I'm like, of course not, because again, it had a phenotype. Like growing up in the 80s and the 90s and early 2000s, it had a phenotype. I wasn't jumping around, acting crazy in class. Therefore, it couldn't be me, right? I was a good student, and you can't have ADHD and be a good student, right? Mm-hmm. That was the phenotype, right? It was a clear phenotype. And, once I learned what it was, and I realized, and I looked back at my life at that point, and I was like, oh my goodness, I did. Like again, by the grace of God, got through med school because of ephedra at the time had Xenadrin in it. And I still say like ephedra was like the best stimulant ever for ADHD that I didn't know I had. Mm-hmm. I just it was my caffeine, and I didn't drink coffee, and it helped me study like nothing else on this planet. Like I was so locked in. Mm-hmm. And then they took it off the market because it's blowing people's chest out. So I get through that, and then I get to, now I know like that's my subspecialty, right? I'm locked in when it's highly giftedness and ADHD, because to me, still as a trained physician, autism has a look to it, right? And so honestly, it wasn't until recently, this, that, I still am I would still straddle the fence by saying that I have autism, right? I will clearly admit to the fact that I have autistic traits, right? And so when we talk about what autism is, I have some clear ideas through lived experiences and that of my patients, that I can usually say, okay, you're more in the autism bucket. And that's important for what I do now, to know on which side they lean heavier on. There's still going to be some other things from the other side, but I want to know, are you on the more autistic side, or are you on the more ADHD side when it comes to prescribing medications, right? Because it allows for that first, introduction to medications. If that's what we're going to use, it helps me make that deciding factor.
Yeah, which is really hard when you're asking a patient to know that, right? Because a lot of times we're just us and we don't know that. And it's same as the realization every time you were like,
what are your go-tos though for autism?
I told you, right? How many years ago did I tell you? I knew right away that you were autistic. So the go-tos, there are not go-tos, right? And that's the thing, is that we are trained to look at certain things, and even by our DSM-5, which I do not agree with, those are stereotypical behaviors, right? Not everybody's going to present those behaviors, but that's
or they'll
what
mask.
we use in to diagnose.
They're masking.
Yeah. So a person who is diagnosed later in life has learned how to adapt, how to mask, how to fall under that radar, right? Not realizing we're doing it. It's just what's expected of us. And so we do, especially if you're a woman in society, we are trained to be a certain way from the time we're very young, to be conforming, to be this, to be that. Girls are getting undiagnosed. So those studies that were like, oh, it's all the boys. Well, the girls' studies got thrown out for one, okay, in the early days. But also then we just had the girls thinking no, right? So, but it was the same thing with ADHD, where you were accepting of ADHD for you and highly giftedness and had yourself in this category. The boys that were getting diagnosed in school with ADHD were the problem children and certain
ADHD
things like that.
right away.
Right, but what I'm saying is you accepted
it was
that
hard
later on, right? Where it was hard for me when you diagnosed me with ADHD and I'm listening in clinic to the questions you're asking me as I'm trained to ask my clients, and I know what their answers, And it was when I heard my answers, I said, ugh. And you remember that moment, I said, how did I miss this in myself? Because I'm so busy taking care of everybody else. That's what I've always done. I raised 2 kids with it. I knew where I saw it there. I knew, I didn't even know how I knew that my kids were autistic with ADHD, but their diagnosis got missed in childhood by a psychologist who wasn't listening to me. And because why? I was a young mom and we're going by the stereotype and it still happens. So what do I see? I see 2 different, categories.
Oh, it happens to me.
Totally.
Here's my daughter who
that stereotype.
I told you,
the DSM-5.
I'm like, since she was little, right? She was sight reading at 18 months, right? So I knew the gifted part was there, and I'm like, oh shoot, right? So I'm all about the socialization, and I'm being careful with that whole situation because, again, like I had already seen what being smart could do. And so I was a full believer that it was a problem because being smart, I had already learned, didn't mean that you were going to be successful in life. Like, again, that whole being able to see and extrapolate very early in life,
right,
had that on lock. And I was like, this is a problem. But I know how to solve it because I'm locked into understanding that aspect of it.
So you socialized her.
Right. So part of it. But when I went to her teachers, right, in kindergarten, again, because she's an advanced reader, right, highly gifted. I'm a Montessori mom. I'm all like, follow the kid, and I would say, hey, she has ADHD. Now, at this point, there's no need for me to go get her tested. There's no, I know this.
Yeah.
Clinically, I'm telling you she does. They were like, oh, no, she doesn't.
Exactly.
Up until even last year.
Yep.
Right? I'll go tell her teachers because we're I'm explaining to them that she goes to an amazing school, right? And so I can talk to the teachers and we can come up with a plan without having an IEP on how to get her to perform her best. And they will accommodate. And it's a beautiful thing. But I've definitely had teachers give back a pushback in the diagnosis in the label because they didn't like the label, right? Again, we'll accommodate and we'll do whatever she needs, but no, she doesn't have ADHD.
Yep. And a year ago, we had the same conversation when I said, you said, we don't need the label. And I said, absolutely wrong. We need this label in order to get that child help. And that at that time you didn't understand, but you do understand how important it is, especially in academics. And this is one thing that we can be cognitively enlightened, highly gifted, and still have a learning disability or still have a deficit in something. And I see it all the time. It's math or reading, writing, comprehension. It's always those 2 subjects. And yet we're going, well, they're highly gifted. So those kids are working harder to make the deficit or the learning disability appear with the expectation of the stuff that's easy for them. And that's where we start to see issues. And so I can't tell you how many IEP meetings I do with families and these kids, and I have to explain to the school, is it math or is it reading, writing, comprehension? And when they get into middle school and high school, let me guess, pre-algebra? Algebra? Okay, great, yeah. And they're like, how'd you know that? Because I know this.
So that's where, again, this is why I do use the term neurodivergent. And again, the school my daughter goes to is amazing. And they brought in a speaker last year. He really talked about being highly gifted / neurodivergent, right? And that's where he was, again, you may be, IQ 130, that's the highly gifted cutoff, right? And above here. So say math, right? But maybe like your reading is down here at like 120 or maybe even 100, right? And you're going to go up and down, right? In chronological, not just in aptitude type things, but like in, patterns recognition and so on and so forth, right? And so that's why I do use that term neurodivergent, because exactly of that. Like they may be amazing up here, but still struggling. Yet they've already gotten that label because their overall IQ score, their composite is 130 and above, right? And so because that composite score is 130 and above, and that could be because they're freaking 150, right, in math, but only like 110 in reading and language, whatever it is, right? So it's going to bring that composite score up greater than 130, but doesn't mean, like you said, they're not struggling with something.
And most kiddos are not getting their IQ tested, and especially in public school. This is
because there has to be a reason, right?
Right. And so this is, if I had, again, back to my daughter in school, when we get into these environments and, we can still have those autistic traits, but it wasn't the autistic traits that tripped her up in the school. It was her ADHD traits, having to sit still, having to do this, and that does trip them up quite a bit. The autistic traits tend to hit later. It's those social cues that we're missing, the feeling like we got to be social. Now combine those with all the other things that we're struggling with. And she does have a learning disability. I have the same learning disability. My son has the same learning disability, and yet I would be termed highly gifted, and so would my son, but we have the same reading, writing, comprehension disability. I can understand it, but my brain can't retain it unless I hear it auditorily. So both of my grandkids have that. If we're not finding those things and we're not doing full assessment, which is why full assessment is absolutely key and necessary, don't be afraid of the label. And I can't tell you how many times I tell parents, it's not about the label that comes with that. It is not something that has to hinder them. It's about us understanding and not making this child have to bend to the school system, but it's about making the school system help that child be successful so they can just be a kid and feel good about themselves. If we're not finding out what is going on in their brain, we're not doing them a service. We are not helping them be their best selves. My daughter, I watched her self-esteem tank, and that self-esteem turned into all these other things that she struggled with all through high school. Was it her fault? No. And did I handle it right as a parent? Absolutely not. Because what do we say? No. I know your potential. And that right there, I can't tell you how many times I heard from my daughter, I can't be you. I'm not you. I'm not going to do it perfect like you. And I was like, whoa, girl, I never asked you to, right? But that's the message that we send to them, that you are less than, that you're not good enough because you're struggling in these things. And I sat down, I got my kids through school. I don't know how I did it. I was a young mom. I didn't know about IEPs. I didn't know until I was doing my grandson's IEP. And I told my daughter, they didn't have this when you guys were young. And the psychologist told me, yeah, they did. I said, what?
They just didn't let you know that they had it.
All this work, but it strained our relationship because I was the one having to be the heavy on the homework and all of these things and sit down and teach them after a long day's work. Sometimes I worked 2 jobs as a single mom. That made it hard, right? So like when you asked, how do I deal, my kids were at all these different levels at all these different times. And I had to step in and figure that out on my own without support, without help, without a family that understood, because nobody understood that any of us had it, right? I've seen pictures and had asked my mom, okay, so my brother crawled backwards only. I crawled only with my butt up in the air on my hands and feet. Yeah. And then you actually wrote on the back of this baby picture that my tongue was out of my mouth all the time. And you didn't think there was something going on with any of your kiddos. And my oldest brother's super bright. I always thought he was the most intelligent of everybody, but also very depressed. And I thought, you miss all the way, but she missed her own diagnosis too, of course, right? And so, and admitted that, like, man, and she was so relieved when I told her, Mom, you are autistic with ADHD. And she was so grateful that I told her that at 73 years old, because it made so much sense. And it took all of that, just feeling like she never fit in, away.
And so again, my theory is always that, neurodivergent brains are highly gifted with traits of autism and ADHD, and just having that type of brain, you're going to again fall into all of the traits. And so again, when people just want to classify themselves as highly gifted, like now to me, that bothers me to no end, because we're missing so many crucial things that are going to, again, if they're not recognized and addressed properly, they lead to the issues with self-esteem. They lead to the issues with depression and anxiety. And then again, down the road to, bad choices, right? The things that get kids in trouble, right? This is why I said, I know that being highly gifted does not mean you're going to be successful in life, because I saw them in high school go break bad, right?
Yeah.
Like not go to school, getting into drugs, like literally same guy who got a perfect score on his ACT and his SAT,
but has a lack of
dropped out of school, total bum.
Right. But so as if I heard you correctly, you were saying that highly gifted ADHD traits fall into the neurodivergent. Where does that leave all the other people who are autistic and ADHD and are not highly gifted?
We have this again. It's my theory. Again, right? So highly gifted, where you have a composite of 130 and above, right? That is a small segment of the population. I still truly believe, right, that the higher your IQ, right, even if it's an immeasurable IQ, because I do believe that they have immeasurable IQs in something, and that sometimes they're just locked in that brain. But I believe that there is something highly gifted in that individual. I believe that there is an IQ measurement of 130 and above in something in the most autistic person. I believe the two are so synonymous, right? The higher your IQ, I believe the more autism you have. All right, that is my belief, right? So even if it's locked in there, I think there's something so profoundly gifted and almost savant-like, right, that we may not be able to unlock, right? I think we have a better chance at unlocking it now with, plasmalogens, peptides, TMS, right? There are definitely ways I think we can move things faster for these individuals and then unlock them in ways that we couldn't have unlocked them before. But that is my personal belief, right? That the more autism you have, the higher the IQ is in something. It may not be the composite. I just don't believe that. I don't think, that's why I still use the umbrella, because I still personally believe that there is something in them that is a gift.
Oh, I do believe that every autistic person has something in them.
And everybody has
Absolutely.
a gift. We're talking about autism, but yes, everybody has a purpose and everybody has a gift.
No, I get that. But even
it's something in them that's exceptional.
Yeah.
Right.
No,
that goes above their chronologic age.
Everybody has that. And so
everybody has something to offer the world, but they're not always exceptional.
No, but I'm trying to understand if highly gifted and savant, are you talking about those being academically?
I never use academic.
IQ gifted? Because
I don't believe IQ is not synonymous with academics. Like, you'll never hear me talk about academics. I could care less about academics, honestly. Like, I am one of those smart people who, again, I have a problem with our educational system. I have a huge problem with our educational system. So the two are never synonymous, right? Because you're gonna miss, academics will miss all of that. It's not designed for any of that. And again, these beautiful brains, these beautiful minds turn into drug addicts on the street because we don't know how to recognize it. Mm-hmm. I think one of the things that we both agree on is a good evaluation, right? Mm-hmm. In my personal practice, it's like where we start, right? With a good evaluation. Yeah. And even in our neurodivergent program, it's about having this amazing evaluation, right? Where we're looking at brain mapping, we're looking at labs, right? Again, because I've done this, unbeknownst to me for over a year now, right? Dealing with autism and their biological needs. Now because patterns is the thing that I'm good at, right? I recognize these patterns a lot quicker, and I understand the medical conditions that are going to be more prominent in people who have more autism. So when I was asking before, like, what traits or what behaviors signify like more of the autism for you? And like, again, I have some definite ones in my brain that stick out. But again, if people were like, you know, yes, it's a spectrum, but there are definitely some things that I feel are more associated with autism than maybe the ADHD side. And there's a lot of overlap. I don't even like looking at highly giftedness as being a thing now. I could say like you have a high IQ, but those traits that you have, they're gonna live in this other bubble, right? Mm-hmm. Like we want to associate highly giftedness with having those sensitivities, that sense of justness, like justice, things like that, right? That they say these are your signs of being highly gifted. They are significantly overlapping with ADHD and autism. Probably more autism, to be honest, right? If you look at the traits of just highly giftedness, because that's all they want to be called, because that's a good thing. But again, because there are definitely books right there who are identifying that highly giftedness has its issues, right? But they're not autism. Yeah. They're the issues of the highly gifted people, right? Because they are not phenotypically, though some are, autistic, right? That's again, you know, the overly shy, right? The not making eye contact, right? Again, I think I was well trained on Asperger's, but because autism was more of a spectrum, I don't think our training was very good when it comes to that at all. But Asperger's, right, was like that more extreme version, right? Yeah. Signifying like something's wrong. Right. So again, it had to be a pathologic thing for us to recognize in others. And now we both clearly disagree with any and all of that. It really is about having that really good evaluation up front and then starting to recognize as a society that would be great. But just as trained professionals, my goodness, can we start there, right? To start to recognize just basic traits, basic screening. I mean, we have basic screening for anxiety and depression. How come we don't have basic screening for autism and ADHD?
Because of the spectrum. So the reason I couldn't really answer the question that you had posed of what do I consider it to be? Mm-hmm. I can't answer that. And one, because each client that walks in my door, I see something different in them that some, sure, they're going to be similar, and some are going to be in this, box that DSM-5 gave us, or some are going to be very, obvious traits. But if I walked into someone's door because I have a lifetime of adaptation and just these things about me, they're going to miss those traits. And so I have learned, so the fact that I'm social, they're going to miss that trait in me. Okay. The fact that I can carry on a conversation, they're going to miss autism in me.
But what is it that they could ask that you could answer truthfully to that would signify that you do?
So honestly, a lot of the reason that the assessments are really self-report, it's what the person is feeling in any given environment, and it's environments across the board. It's not, I feel uncomfortable in this environment, but I'm here. But yet, my clients will feel very comfortable at home around family that is their immediate family that they're safe with, but then go everywhere else and have a hard time, and selective mutism and all of those things. But still, those traits are there from a very young age, and they're still there. They just learn to trust a little bit more. So I start looking for some of those black and white thinking, a lot of the stuff that I had, very rigid, right versus wrong, justice, injustice. Those traits are significant in a lot of us autistics, the ones that are stereotypical. Mm-hmm. But we've got to look past that, because we are adapting into a world that we don't fit in. So sometimes, can I say, okay, this person I can tell is autistic? Sure. By some of those things like let's face it, we like I love soft clothes.
Of course.
So yeah, a lot of times some autistics put those pajamas that are soft and they will wear them everywhere.
No
and
tags.
people will make a thing. But yet I'm doing that too. Everything in my office is soft because it feels pleasing to me, to others that I know I've worked with, but I have to adapt my office to each new client that walks in with the new thing, just like the color aversion, the sound aversion, that I don't like this color because it makes me feel this way, but I love this color. I have to have each office set up differently to accommodate and understand that each person's going to walk in here with something different. And I, as a clinician, need to be willing to adapt a little bit of what I'm providing to make that person comfortable and not the other way around. I want to play
devil's advocate again, right? Because I get this quite often. Again, even though a good majority of my practice is neurodivergent, right? I do have more neurotypical people, and who will say, or don't believe in the diagnosis. I've never really heard people say they don't believe in autism, but I definitely have heard people say they don't believe in ADHD as a diagnosis.
Because it used to have an ugly, somehow it's become this wonderful thing. Where before it wasn't. None
of it is. Like there's challenges, and as an adult, I believe in adult accommodations, right? Adult accommodations, to me, look like having a housekeeper.
And to me, that's self-care.
Right.
So I promote self-care.
But so for me, and this is what I was trying to ask before, because again, you have those people who doubt the diagnosis. You have the people say, well, I do that. And well, do I have ADHD? There is a distinct difference, right? In how you internally feel and how it looks like as you say, in different environments and how it shows up. People say, again, because the traits are not unhuman, right? Forgetfulness is not an unhuman trait. Being stubborn is not an unhuman trait. Being judgy is not an unhuman trait. Being, what is my child? Shy, is not an unhuman trait, right? So at what point do we then look at these things as being more pathologic, but sometimes not to the point where they're DSM-5 pathologic, right? Because we've learned to move towards the middle, but it doesn't mean that it doesn't cause internal disruption.
Right. So I'm going to put this to you in a mental health perspective, how I came into it and realized just how, and I realized people for some reason have been calling me the autism whisperer before I ever went into counseling. Right? Because people will come up to me on the street and always have, in a grocery store, in a Home Depot, whatever, and have a conversation with me. They see something in me, they feel something in me, and they confide in me, and that works in my field. But the reason that I'm not breaking it down to this or that, because in the medical, it is scientific. Right? In a mental health world, it's not. This is what I see walk into my office. I was previously diagnosed as bipolar. I was previously diagnosed as schizoaffective. I was previously diagnosed as borderline personality disorder. And then it is my job to realize that even in the DSM-5, we are told to rule out biologic factors. Anything physiological that could seem like this disorder that they have been given by other therapists, because we're not trained to see autism. In my mind, autism is a biological factor. It is a physiological factor. It's a medical condition. And if we are not ruling that out and recognizing that autism mimics all these other disorders and all the symptoms from them, we have a problem. So how do I figure it out in my clients? When they tell me they have this disorder or they're showing these symptoms, I say, okay, tell me about your childhood. Yep. And then I hear, I was bullied. I was told I was annoying. I was told not to talk. I was told to talk about my stuff too much. I didn't really care about other people's, what they wanted to talk about. It was about what I was talking about. So I have to go all the way back to the beginning.
Yes.
And then I know.
Yes.
And then I can now have to convince this person who is set that this diagnosis of bipolar is what they have, even though the medication doesn't work, and you don't have bipolar if the medication, if you're not on it and you still have the symptoms, right? If you're on it and you still have the symptoms, it's not bipolar, right? And bipolar and borderline start later in life. So if you can go all the way back to their childhood and the symptoms were there and the social struggles were there and all of that stuff is stuff they were missing along the way, and that right versus wrong and the justice and injustice and the black or white thinking was there all along, and they felt like they didn't fit in, that's when I know. And why? That was me my whole life. I was the puzzle piece that didn't fit into any of my family. I didn't think I fit in. I didn't think like them. I didn't feel like them. And yet, why? I know now, because we're all a different level of autism,
yes.
right? We're all different levels of cognitive ability, and yet we're all neurodivergent, all of us. But I still didn't feel like I fit in because I was different than them. And I always felt that. I learned how to adapt. Why? Because my dad was super social, so I mimicked that from him. That's my superpower. Now, that's the only reason that I'm good, because he taught me how to mask. And I masked.
Again, so we were talking about how, again, a lot of these traits get socialized into us, or we get socialized towards the middle so that we can, be more productive in society.
But how do we feel internally? That is the defining factor between
I agree.
Autism, not autism, neurodivergent, not neurodivergent.
I agree.
Society can say this, and rule books can say this, and these
hidden.
books can say this, but how do we feel inside?
And that's the hidden factor.
Honestly.
That is the hidden factor. And so, and so that's essentially what I was alluding to. So when people try to say, well, I might have ADHD too, right? One of the first things you do is you go back to the beginning, right? Same thing I had to do with myself, right? I was like, well, I start tracing back. I was like, it's been there all along, which is why I've always vehemently denied the diagnosis of adult ADHD. I do not believe in that diagnosis whatsoever. And that had been popular at one point but again, it goes back to what I talk about threshold, right? And so, younger, I remember my memory was good. My recall was amazing, but I didn't have bills to pay. I wasn't dry. I didn't have all of the stress. Yeah, I did not have all of those responsibilities. And so I raised cognitive ability is going to be a little bit different. And so as the years progressed, things were still easy for me, not too bad. College, easy for me, not too bad. Med school started to be a little bit more of a struggle, large volume, way too much. Things are going on. And so that threshold started to come down. Again, blessed enough to have a FEDRA, got through med school, got to residency. Some of those stressors are over because residency was a little less stressful than med school, right? And so when I was, on my own, not having a whole bunch of responsibilities, I was still cooking with gas for the most part, except for when thresholds would come. And then that threshold would come down.
That's right.
And then once I'm now out in the world, out of residency, now I'm the physician and I'm responsible. That is honestly when the diagnosis came for me, because my threshold had gotten down here and it started to unravel for me. And my desk was things were just unraveling, right? It was becoming way more pathologic. I was falling behind. It became more problematic in life at that point, because now my threshold was lowered because of the responsibilities and the stressors. And I say, when those come, that's when your threshold gets lowered, and that's when it pops out. So that's why it comes out later in life, especially for women who've been able to function at a higher level for so long until something happens, right? It's always been there, but now something's happened and now you see the pathology. And so that's why I try to say it doesn't matter how much more you move towards the middle or what you kind of learn. Not that it doesn't matter, but you can learn to move towards the middle. Doesn't mean that the diagnosis is not there just because it's not pathologic in that moment, right? At some moment, it may be when that threshold gets low enough. And so when we don't recognize what the diagnosis really is early on, whether it's pathologic or not recognizing it and waiting late in life, that's when bad stuff starts to happen. So if we could evaluate early enough, learn early enough, right, we can prevent a lot of that, right, from happening to people in a bad way. And so when I say, what are some traits, right? What are those things that you can look to? I've mentioned a few of them, right? Like shyness. That was one for me. I was just a shy kid. The rest of my family wasn't shy. Like, they're very outgoing and like all of that. That wasn't me. I was a really shy kid. I learned later in life, like in med school, I then called myself, introverted after doing Myers-Briggs. I'm like, oh, I'm introverted, not autistic. I'm introverted, right? I don't draw energy from people. Like, they tire me. Yet I could be social because I came from a large family. So I can mask, I can get through it a little bit, but inside it's eating me up. Take me someplace where I don't really know anybody.
Yeah.
That's the internal part. Internally, I'm dying.
But that's
right. But I'm masked on outside.
Autistics.
Right.
So my Myers-Briggs is the opposite of that.
Yes.
And yet I still have moments where it is hard for me. I will trip over my words.
But were you socialized into that? Or do you really feed off for people?
Okay, so some of that for a person who becomes social, it's attention seeking early on. And that's where we have to understand that's the fine line between someone who's social and can still be autistic is the attention-seeking behaviors, right? I had attention-seeking behaviors, which then is going to make me more social because that's what people are going to want to see, right? And so then I just learned to mask very early on. Then there's the cultural, being Hispanic, Italian, raised to follow the rules, and the girls do all of these things that the boys aren't expected to, and And in my younger years, I was okay with that until I reached like 10 or 11. And I'm like, no, not making this because I'm a girl. Like, I became more stubborn, right?
Yeah.
And so we see these traits that would be stubbornness, this, rigidness, this, I'm introverted. My mom's super introverted. She will tell you, I hate people. Okay, she's overtly autistic. How did anybody miss it, right? Mm-hmm. But then I go back in mine and I'm like, how did anybody miss it? Like, I was dressing up as a little kid. I have school pictures wearing Little House on the Prairie outfits. And nobody thought, gee, this child, right? And back in the 80s, right? Cosplay wasn't a thing. But I was doing it. I played alone at home. I didn't do that at school because that wasn't what was accepted. Mm-hmm. But at home I did, and all of my memories, that's what I did. I played alone. Those were my best memories, just playing by myself. I had 2 older brothers. I liked playing with them until they didn't like playing with me. Then it was like, okay, whatever, right? I'll play. But I didn't fit into anywhere. One of my eldest brother's favorite jokes is that a girl that was bigger than me in size, but younger than me in age, punched me in the gut, and he laughs that I cried at that, but I didn't like to be hit, and I didn't like to be bullied, right? But that made me not be able to fit in, but I couldn't fit in with those girls because I wanted to be nice to everybody. Mm-hmm. I was a people pleaser. And that started at a very young age, right? The attention-seeking behaviors, I realized I can get attention if I'm people-pleasing. People are accepting me. So that's why I said I see 2 categories. I see people that can't see past themselves a lot, and those would be more rigid, more it's about me, and it's hard to see past that. And so those are the people that later in life are termed narcissistic, have narcissistic tendencies, is because they can't see past themselves. They're disconnected to some degree. And that starts in childhood, disconnected, but we can teach that. We can teach how connect, attachment, therapy. But then there's the people pleasers who that's how we got praised. That's why I use my academically gifted part to be great. And all those ones that I had that learning disability and those deficits in, behind closed doors, I spent 6, 7, 8 hours a night studying those subjects so I could still be academically gifted and still be recognized by those teachers. Everybody hated me because I was a teacher's pet.
I would say teacher's pet.
But that person gave me attention. That is where that people pleaser, and then it's a lifetime, and learning how to break it is a horrible habit. So when I start hearing about habits that people have, the other trait that is pretty prominent in a lot of us is control. The need for control. Controls is safety. So we can hear that, right? And all this. And I remember being in therapy years ago because I was the only person in my family believed in it, and I would go to therapy and they'd go, well, that's just you seeking control. And I'm like, what are you talking about? I'm the least controlling person. When I go it back through my youth, and there's some girls in high school when I was the captain of the team, I wasn't very nice to them if they weren't doing well. And I'm sorry about that, guys, but that is something that I didn't learn until later. Like, oh shoot, that control was real in me from a very young age, because so many things were hard that's how I made it safer for me. I controlled it. I controlled my environment. And I always tell people, kids start, autistic kids or ADHD kids, all of us, we start to control our environments and the people in it from a very young age because we're having trouble adapting. And so what do? We bend everybody to us through manipulation and lies, and we become master manipulators. Woo! That's what a people pleaser is. We become master manipulators. We take things that are hard for us and we bend everybody to get our needs met. Can we blame a child that's doing that? No, because they need something and they don't know how to communicate it. And it's no different than the people that are nonverbal. They just don't have a way to communicate it to the people who are expecting them to say it in words, but they still need their needs met. And so when they're not getting their needs met and they don't seem to know, because we have to teach them how to do it, we tell them they're a level 3. Because they need a certain level of support, which suggests, okay, but did we teach them this thing too in a way that maybe they can understand in their brain, not through words? We go, oh, they didn't verbally understand. So then that makes me wonder, what kind of assessments are we doing?
We're not doing assessments.
What kind of IQ assessments are we doing? Do we have to be verbal to do an assessment? Do we have to read to do an assessment? Do we have to have this certain thing? There's limits. So how many super intelligent people are we missing because they cannot fill that
because of the locked in part? And I think that's where I come in, right? Learning the biological differences in neurodivergent people, and even to the most recent theory, right, I'll call it, of mine, when it comes to I remember once I got out of this insurance-based practice and got into my practice, one of the first difficult cases, I should say, or complex cases I had, was a lady who had multiple issues. She had been to Mayo, she had been to Cleveland Clinic, she had been to UCLA, she had been all over Nevada, right? Trying to get answers, right? And she had come with only one basic that I can remember, one solid one. For the most part, they said she was a malingerer, right? So they basically said she was a malingerer, and she completely was like, "That's not it. Something's really, really wrong with me." But I remember her having mast cell activation syndrome, and that being the first time I even heard of the syndrome. I didn't know what it was. I didn't really understand it. And so because she had it, I had to learn everything I could at that time about it. And from that point on, I've had more autistic people show up at my door. Obviously, if you want to say they're going to be more cognitively enlightened, obviously being the type of practice that I have. And so they've taught me a lot along the way as well. And so again, this was way before I even considered that I had it or that my daughter had it. I was starting already to think that my husband had it, but all I could see was narcissism. Until I remember saying to you one day, you were like, narcissism is autism. And I was like, I'd already started considering it, but I was at that point so far gone that I was like, he's just a narcissist and I don't care. Yeah. But, obviously fast forward, that was a mistake on my part. I wish I would have understood significantly more about that. I probably would have pushed harder, but again, no regrets. Everything happens for a reason. So because of all of the autism that came before me and the mast cell activation syndrome and the POT syndromes and the joint laxities or Ehlers-Danlos, right? Their inability to take stimulants, right? Because again, I could recognize ADHD and highly giftedness pretty quickly in people after having a conversation and then drilling back a little bit. And so they would come to me and I could quickly see the ADHD part, right? And I'm like, oh, okay, we medicate with the stimulant because stimulants are great, right? They help you function better. If you truly have ADHD, but if you don't, it's a whole different experience for you. And so those patients I would put on a stimulant and they would start to have worsening of their autistic traits, right? Some of those sensitivities would get worse. And so learning, that's why I say for me, it's important for me to try to recognize which side of that spectrum do they have more challenges with or more present for them. And so, because if they do have more of the autism traits, I already know I probably shouldn't start with the stimulant.
So I think for me, I know that you're breaking it one way, like a pendulum, right? That goes one way.
I know they have both, but again, so when I try to make decisions, right, about medications, right, so that, it's not a lot of just trial and error, because again, you can come to me and like, oh, you have ADHD, boom, here's a stimulant.
Right.
But if you have more of these autism traits, then again, what I've seen time and time again, and again, what the information that my patients have presented to me is that, yes, it's helpful, but it also worsens some things for them. And so depending on where they are in life and what's going on in life, some of those things that they worsen aren't going to be compatible, right, for their lifestyle in that moment, right? And so I do have to try to pick and choose. Also, the same thing that the more autism traits that they present with, right? It doesn't mean like there may be some that are masked or hidden, but they tend to have more gut issues, right? Doesn't mean that, again, that's why I'm like, it's a spectrum, call it neurodivergent spectrum, right? And so for now, like my whole thing is if you're neurodivergent, you're gonna have brain inflammation, you're gonna have gut permeability issues, right? To what degree? That's a spectrum, but it's there. All my sinus issues that I've had my entire life, right, that I just didn't understand were sinus issues until later on as a physician. I figured that part out real quick. I'm like, hey, I got sinus issues. I can fix sinuses better than most. Learn how to fix me, but I now recognize significantly, right? Again, in my practice, the last 3 years, right, I'm teaching people how to use nasal sprays, and we're talking about their chronic sinus issues that they've never really treated. They've just kind of lived with it. To me, that is a component of mast cell activation syndrome, right? Not as severe as some of my patients who are really suffering from it, but there's that component of histamine sensitivity, right? Releasing histamine significantly more and easier than others, right? I think is one of those medical conditions and traits that I recognize being part of that community. Not to say, obviously not only, but it is very significant in that population. So mast cell activation syndrome, POTS syndrome, Ehlers-Danlos, what else is there? Obviously, brain and gut issues, right? So those are my high alert medical things to be able to say, hey, you could be suffering from this. And again, we always start with this amazing evaluation now, right?
Things too, like thyroid conditions, all of those.
Well, thyroid
these big is comorbidities,
not
right?
as much as a comorbidity, because again, I practice in a place in Louisiana where, again, we're taught that thyroid disease is female over 40, right? Kind of thing, right? That's usually where you start to have issues. Females in their 40s. But I practiced in this area in Louisiana where I saw so much outside of the norm, right? The thyroid disease was outside of the norm. These people are not neurodivergent. And that, to the point where I'm like, is there a soil issue in this part of Louisiana, right? Because it's, right, thyroid is iodine, selenium, zinc. Like iodine is a lot of other things. Thyroid is a lot of other things, not just it. So it doesn't mean that other medical conditions obviously, don't occur, right? They have insulin resistance issues. They're going to have thyroid issues. They're going to have hypertension. They're going to have all these other things. But the things that are more unique to that population are those particular things. Thyroid is not unique to them. It's just one of those things that it could be prevalent, but I have thyroid nodules, right? I'm neurodivergent. My mom is very ADHD, with probably traits of autism, but her ADHD is super prominent. But she doesn't, right? So that's just one of those things that I wouldn't classify thyroid in that, but I definitely would say that, those others are definitely more prominent in that neurodivergent population. But again, something we're not trained to see. But that I've noticed over the past 3 years when I look at myself and my patients, like that is a common thread over and over and over again. And now with our program, because we, do this evaluation and, based on that evaluation, we can actually go into more advanced treatments that we didn't have before, right? And that makes therapy even easier.
Yeah. And I think it's important for us to stress that it's not one evaluation. How you and I are doing it is an evaluation by, a doctor, an evaluation by the psychologist, evaluation by a clinician like myself, are doing these multiple ones. What I was going to say with the pendulum swinging is that any condition that is left untreated, now whether that's untreated medicine wise, whether that's untreated, with talk therapy or any of the other stuff that we can do, you're going to see, if they are autistic, you're going to see those autistic traits come full force in sensory issues, right? And so that's where those will present. So if we are only looking at certain things and going, we can treat these things, when, like you said, stress happens, or, things happen that we're untreating this particular condition of ADHD, it can set off all the autistic traits even more because of sensory overload in our body, because of things that stress will exacerbate that. When you diagnosed me, I was going through a very stressful time. And so I was very glad that you were able to see that, but you would have never saw autism in me. It was something that I figured out only by talking to the clients and educating myself on autism more and getting my certifications and going, okay. And there still isn't a client that walks in my building that will tell me a story that jumpstarts a story that I'm like, I had that. And so for the first year, I was like, yep, that's me. Yeah, okay. And then I had to deliver it to you. I know I'm autistic too, and these are why, and and all these things, because it was glaring at me then, but I hadn't been around anybody that was diagnosed with that, right? That even though I worked in the field for 10 years, the cases that I had were the ones that were beating me up, were doing that, and I was really good at those cases, so I got the harder and harder and harder ones, and it helped me understand the different levels of the brain and how this presents in different people, and that they're not really meaning to beat you up, and this is just something that's happened because it's a sensory issue that has become overwhelming and all of these things. And so that's how I started seeing people differently, and from kids all the way up. I see across the lifespan in my clinic, and new people walk in and they have something new. So I can't put my finger on it, but there are times I just know. And it is hearing those stories. And I would tell you, in my student practicum and internship, it was the tougher cases that they came in with the diagnosis, and I'm like, you're not fitting into that box. I get it, I'm a student, but I'm telling you, you're not fitting into that box. That's not it. And it would take me months, and then it was one story about their childhood and not realizing they were being bullied or things like that. And I'm like, tell me more about that. And then I realized it's autism every time. And I would send them out for their diagnosis because, in Nevada, I can't diagnose that. But I'm at a pretty 100% rate of being able to see it, send them out, they get the diagnosis, and then I work them through, what does that mean for you? Because it's not going to be the same for you as it is everybody else. And that's what I do, is what does that mean for you? How can we get you to acceptance, understanding yourself, your body, what your sensory. A lot of people don't realize they have sensory issues until I tell them. Oh, that's a sensory
because that's
issue.
who they've been. That's the body they've lived in, and they've adapted, and it hasn't become a
And by the time you would ask me one time, I don't know why I have so many clients walking in with autism, but what did I tell you? Because we are tired of people not listening to us, and we will keep going until we find the doctor that hears us. That is why I followed you from your other one to your own private practice, because you were the first doctor that should have spent 15 minutes with me and gave me an hour and a half. And I told you, 105 diagnosis, it cannot be. Like, it cannot be. This is not right? Because that's what the medical world is. We send you to this specialist and this specialist, and you're just like, there is no way. The list, it was so long. I said 105?
And that for me, person. Right, for my type of brain, like that energizes me. And I'm like, yeah. Give me the hard stuff. Give me the stuff that nobody else can figure out.
You're going to turn the medical world upside down, and I'm going to turn the counseling world upside down, and we're going to make change because it has to happen. The system is broken.
Oh, very much.
Absolutely broken in so many different levels.
So I would say it's the system that's broken and not us.
Correct. The system is broken. The way that we are diagnosed, the way that we are treated, the way that we are seen or not even heard for those things. For a woman, back in the day, it was hysteria. Oh, we're just making this stuff up that we're feeling this. I can't tell you how many doctors almost killed me, but I didn't give up and I kept going. And guess what? Now I can tell people, if I tell you I'm not feeling well, please take it serious, because it's always ended up in a surgery or a week-long hospitalization.
Absolutely.
100% of the time. People listen now, right? Because they don't believe it until they go, oh, crud, she's being hospitalized. You think? I've been telling you I'm sick. I had two things, my thyroid and my gallbladder died.
So I'm going to ask, so what about, again, so that, again, I keep thinking about, because I'm really good at the ADHD part, right? I'm really good at the, your IQ may be elevated part. I'm not as good. I'm better, right, at the autism part. And again, and I'm getting better. That's why I'm asking you, because again, I keep trying to pick up on what are those cues, right, that you get. The cues that I get now that you just mentioned is pain sensory, and again, sensory issues and pain. And so I distinctly remember having my daughter, right? And we could talk about like the stuff that goes on with autism kids in utero. I think there's something there too. But after giving birth to my daughter, she didn't really she wasn't crying. Like but that was it, right? They stuck her with like every needle in the world, and it was like this delayed, that was it. Like there was no like persistent crying. And I remember like the nurse holding her head, and she just held it up, and she was just like, and looked at her like in amazement, like, she really doesn't cry. Like we've stuck her and she's not crying. And I remember that it still pains me. Like I accidentally like pinched her, like fastening her in, and I pinched her arm, her skin in between the little claspy things. It hurt me just thinking about it again. And she cried, but it was so brief. And then it was over.
Yeah.
Right? Her and her dad, again, when I met him, he was like in pain from a hip thing. And he was like, I gotta have hip surgery. I was like, you gotta do what? He's like, I gotta have hip surgery. And I was like, you've never complained about your hip. We do all kinds of stuff. You've never complained about your hip. He gets in there, he's super stoic, and I was like, and he tells the guy his pain was like an 8 out of a 10. And I was like, we've been together for over a year. What? The stoicness. So again, he was the person that I had to tell him, I'm like, look, it's gonna look really bad, you having a wife who's a doctor and you just fall dead because you didn't tell me something was wrong. So you have to tell me something's wrong. I don't care how little it is, you have to tell me something's wrong. I'm not gonna believe that you're complaining if you tell me something's wrong. Right, but I need to know. I've had to do the same thing with my daughter, who, I think has, again, more of those type of traits where they're very stoic. They feel pain a little bit differently.
It's a sensory thing.
And that's what I was trying to say. So like that to me is one of those, you do check more of the autism box, right? If that's an issue, right? And I think my daughter's perfectly aligned. She has like, I think she's 50-50 autism and ADHD, like heavily.
And I told you there's more sensory issues there than you guys are aware of. And I can see that
for her.
In her. And so my son, the same. So let's talk about the 8-month-old infant who's barely sitting up and everything. And then all of a sudden slams his head on the floor because he got so mad. That baby didn't cry. And I mean, he hit his head on the floor hard. It's the same thing I watch my grandson does when he has a sensory. He's overstimulated. He starts slamming his head against the wall. He's not crying because he slammed his head against the wall, because he'll put welts on his head. We had to put a helmet on him at some point. It's because of the other overstimulation in his senses. So what I tell people is, it's like, for some of us, we're empaths, and it's like having our nerves on the outside of our skin. So people's energy can walk in and we feel that energy, and our vagus nerve is activating. We're like, oh,
but it has to blunt somewhere in the brain.
So I have a very low tolerance for pain, but a very high threshold for pain meds. So meaning that I could take all the pain meds and they're not going to dampen that pain because the tolerance, because I'm an empath. Whereas my son, same thing. When he was a toddler and he was walking and we'd take him in and they'd stab him in 4 things, my son would get up off the table, not cry, walk out the door and go strutting down the thing. And I'd have all the nurses looking out the thing like he didn't even shed a tear because he didn't feel it. It didn't bother him. It just didn't. Whereas my daughter is like me, very low, cry, still afraid of needles, because we feel it, because we're empaths. So the energy for us is worth. My son doesn't have that. It's a different level. So it just is those different sensory levels that we have. So that's why how I explain it to people. Sometimes we just don't. Some people can feel that and some people don't. For him, I don't know that he ever really developed kind of that super pain threshold, whereas I don't do well, and it doesn't do well that I'm allergic to all the pain meds, because I'm like, I really need the pain. Like, I'm in pain, it hurts, right? And it could be the smallest hurt. So like that story I told you where they punched me in the stomach, maybe to him it wouldn't have been a thing because he doesn't feel pain as much. But to me, it was the end of the world because it hurt, right? And so when I would go to the doctor and say, I'm feeling this, I'm exaggerating, but I wasn't. And it's because the sensory issues made it so much more heightened for me. And so when a client will come in and they'll be talking about these things, I can understand it. I understand the different levels because I've seen it at all these different levels throughout my whole family. And so I just know, right? And I'm able to explain it to them a little bit better. But it's understanding that what you think is the norm for just the typical body is not for an autistic person. We have so many different levels of sensory issues, even the color aversion that you didn't think was a thing, but it is a thing. It is a thing, right? And so, I need to find out if there's a test for that, because there has to be, to where we can do that. And if it is a thing, what if it is overstimulating her body? We need to help, not fix her, but fix the environment she's in to help her at ease, because that's something inside the brain, that's something inside the eye.
It's definitely a struggle. Again, we're gonna go back to like the brain, which is why it for me, it all starts there. It's a gut brain issue for sure, right? Which is why we try to do, again, our evaluation is the neuropsychological eval, the brain mapping. We start there. We do prodrome scans, which help us understand like levels of plasmalogens and inflammation in the brain. And then we do gut testing, right? So we understand like the permeability of the gut. And if they're, again, because oftentimes, children who are neurodivergent have, not the most normal diets. They have, food aversions, or they have, specific things that they like. Not that they necessarily eat unhealthy, right? My daughter wasn't an unhealthy eater. Her thing was, if it's green, I want to eat it, but I don't want my food to touch. Like for a very long time, it was like, I don't want my food to touch, and I don't want to see a lot of food on my plate, right? So if it was too big, she wasn't going to eat it. Now she could eat the same amount of food, but you'd have to give it to her like at small quantities at a time. That's the only way she would eat it. But if you gave her a heaping amount of mashed potatoes, not gonna touch it.
Yeah. My grandson is barely gonna be 3 in January, and has just now started separating and making my daughter separate his food. So it happens very young with those things. But where I wanna make sure we can help where we're gonna help, and we're gonna do the test and we're gonna try to help. But I don't want to change every aspect like that. If I prefer doing coloring in black or gray, and that's what's pleasing to my eye, doesn't mean there's something wrong with me.
No.
It means that the world needs to go, it's okay. And sometimes we will have to adapt the environment so that person can be more comfortable. If it's causing overstimulation, we can look and see where we can help. And if just like with color blindness, right? They're seeing the world in black and white, and we've created these glasses. Well, why can't we create the glasses? If it is something, that's where we need to understand where if there is a color aversion or something that's going on, and we can create something to make it easier on her system, to where maybe it's not just an inflammation or a medical thing. Maybe it's just part of the way her autism is. Could we create something to make it pleasing for her so she can see the world, the colors of the world, and not feel, I don't like them. It's uncomfortable, because that's an internal feeling that we're getting from looking at color.
If that internal feeling is going to lead to like more disruptive issues, right? If it's going to lead to depression, if it's going to lead, like, if, you know, because that's essentially where I have a like problem with not understanding the traits, right? Because when we don't understand the traits, then we can't really help people deal with them. And I think that's kind of what you're saying. It's like, here, if her trait is like she has this color aversion, right? And then being able to understand that so that it doesn't cause so much disruption that she feels overwhelmed in her body, that then leads to other outbursts or other behaviors that are not going to be beneficial to her.
Yeah, right? And I don't see that for her, because she likes it about herself, and she's
very monochromatic. I mean, when you say it now, like the fact that she's very monochromatic, right? But that's really no different than me, right? But
it's not something we have to fix, is what I'm saying.
And I haven't fixed it.
And we can do testing, and we can say, hey, this. But if she's comfortable with it, I'm not going to try to change it.
Yeah, and I think that's one of those traits maybe that, again, like, there's nothing wrong with us, right? We're going to be different. And again, there's nothing wrong with being different.
But her brain may not know any other way.
Everything is necessarily pathology. So I think, again, as I sit here in all blue, right? You know, again, I'm still learning some things about myself in these traits of autism, because as you see, I'm still not ready to say that I have autism, but I'm very neurodivergent and I have traits of autism and I have ADHD.
She did say it to me once. I thanked her for that.
I'm messing with you right now.
I'll hold you to that.
But again, like literally just now, I'm like, okay, I'm very monochromatic. So is she, right? It makes it, I can color though, like in that sense, like I don't mind. That's what I thought was different. Like I liked coloring as a kid. Like she did not like color in any way, shape, form, or fashion. But then out of the blue, boop, she's drawing like, you know, she has been taking art classes for her entire life, just out of the blue, right? Didn't want anything to do with this. So again, like these are some fantastic minds, and they can do amazing things. There's nothing wrong with us, but I think, you know, what is key in our discussion today is that we want to be able to find ways of recognizing these early traits, right, before they become pathologic. And that, for me, you know, whether that's evaluation or more discussion about, again, just the simple things. And I think another thing that we brought up was like crawling, right? And I read an article before that said that, you know, people who had a higher IQ typically didn't crawl on their knees first, right? That they were different types of crawlers. That's why I'm bringing it up, right? So, and your children didn't either, and mine didn't either.
I taught them how to.
Of course you did, because you thought something was wrong with them by not crawling normally. My child bear crawled, similar to like what you did. I crawled backwards.
See, I'm like, Mom, how could you miss that?
Yeah, no, I crawled back. I couldn't remember. I crawled backwards. We were early in motor skills, right? Or definitely not delayed in motor skills for the most part.
But there are a spatial phenomena that happens with autistic kids that make it really hard for us to judge spatial reality the same, which is why we either crawl backwards or forward, or we go down all our steps backwards because it seems safer than taking that step forward because that step looks really big. So that spatial awareness for an autistic is different.
Or
levels.
Very gifted. It's a gift. So my husband...
With my daughter, she just did everything...
normal.
What was considered normal. And speech was very rapid and string sentences together. But I also realized it's because she mimicked. Because every toy that I gave the child was a speaking toy. Was every single toy this child had was an educational toy. And so I didn't catch on to that until we were cleaning her room one night at 2. That was our routine. And she threw the ball in the, this ball that talks into the closet. And it said, "What does this?" And she finished that sentence and repeated it. And I was like, the toys are working. But thinking back now, I'm like, oh, she mimicked. She did everything because I taught her to.
So mimicking, right? We didn't teach her to mimic because I was very big on being an independent thinker. So yes, we had all the educational things, but I remember her coming home. She wasn't yet 3. Again, she was in Montessori school since she was 18 months. And so she came home and she wasn't really counting like 1, 2, 3, 4, 5. Like she was starting to count, but she wasn't like fluent in counting. But she came home one day and she was like under her breath, 2, 4, 6, 8, 10. We were like, what? Huh? And I think she went to like 14. So I was like, what? I was like, Naya, come here, right? And she did. And then what did you like? And she's like, 2, and like. And she's kind of like doing it under her breath. I don't know why she's doing it so softly. Come to find out, when they line up, that's what the teachers were doing. And so, and the teachers aren't saying it out loud. Yeah. She's literally picked up on her teachers counting these kids off by 2s.
Right.
Yeah. With no understanding, right? So that's that mimicry you're talking about. Mm-hmm. But she picked it up.
Right.
Right? Because they're so, she came out super observant, which is, again, probably should have known something different. She was obviously different at birth, right? Mm-hmm. Just because she was so wide-eyed, so observant, and in every environment she goes into, observant. Me having to, I had to learn early that, if we're gonna do these classes with the kids, that I had to be there early. I had to be there first, because we cannot walk in to a brand new space with everybody already doing something. Meltdown City is not going to go well. So that is the biggest
challenge in practice, especially when working with someone who is gifted or who has picked this stuff up, because some of it is environmental from their parents who are also neurodivergent, and they learn to speak word for word, mimic behaviors. And then the parent not realizing they've done these things. Well, what's wrong with my child? I'm like, but you guys are exactly the same. That child is saying word for word what you've said to me when they weren't around. They're saying word for word what you're doing, right? And so we learn from the environment. Now, my son, when he was nonverbal, I didn't find all the same toys for him that I had for my daughter, because he was my second. He was 4 years after my daughter. Life happens. Right? Circumstances change. Things are different. It's not just her and now I got another baby to worry about, blah, blah, blah. And it wasn't until I realized, I'm like, well, he's just quiet, right? But we have this special thing. I know what he wants and I'm reading him. And then I thought, oh, shoot, how is he going to go to school if I don't teach him how to? With her, I did flashcards. I did all those things. I didn't do that with him. So what did I do to help him become verbal? I did the flashcards and all the things that I had done with her. And so that helped him. The same with my grandson. He's struggling. I gave my daughter a bunch of cards and said, you got to do these. And she realized I got to make them fun for him. He's still a baby. Mm-hmm. Once she did that, he was excited to please her and be able to speak. But then I gave him his first dinosaur book because he started enjoying dinosaurs. And guess what? This little kid is saying Bronchiosaurus and all these giant dinosaurs. And he's been talking ever since, and his vocabulary is getting better. I told my daughter, it's just because we got to give him those tools. We've got to put the same in to the second child that we didn't. And for her, she had missed the same signs and symptoms in her first child. because it was 11 years. There's 11-year difference. She was young. She missed it. They weren't around me as much. And he was a pacifier baby, so she didn't realize he wasn't talking, right? Because he had something in his mouth all the time. Wasn't until we went to take him for diagnosis, and he messed right through that and missed the diagnosis. And then a thing came on Facebook, those memories. She had videos of him walking on his toes, and I'm like,
tiptoe walking.
So now I tell parents, take the videos with you to the assessment, because they're going to grill this kid who is going to be, I have friends, I have this, I have that, and they're only meeting him in clinic. But you have video proof from the time they are babies of what this looks like. And thank goodness for smartphones. And I was like, why didn't I think of that with him? Because had she been able to take all those videos in there, it was obvious. And I can show her now, see that? Same. See that? Same. She's like, oh my gosh. Right? But we just missed it because we didn't know. And for me, it was just generations of all these things, right? I saw it more in my grandkids. I read a study right after my grandson was born and realized that the study shows that the babies stick in a spot during delivery. The autistic babies, they stick in one side, and they could be a 14-hour, 15-hour delivery, and then it has to be a C-section, and then they take them out, and sure enough, that is the exact location that my grandson was in. He was stuck in this spot. My kids were each 16 hours, but there was no C-section. They just made me do the work until they had to suction my son out. Right?
I was very different, right? I was older mom, but she, and again, just being family medicine trained, like I know too much, right? Because like part of my training is deliveries, and so like I'm a wreck during pregnancy at that age. And so she stayed head down the entire time in the same left side the entire time.
I
Literally.
Send you the study because that's it.
No, she stayed that way. She stayed there. She barely moved.
Mm-hmm.
Right. I worked as a hospitalist at the time. And so I was constantly on my feet, 12-hour shifts or more, 7 days a week, 7 on, 7 off. And so in the hospital, I'm walking all day long. And she got used to that movement, that constant movement, because I'm moving. I am a hospitalist. And so if I would stop in a patient's room, because again, I'm moving all day long. I had 20-some patients to see, right? In a 12 hours, it's insane. And if I stayed in a patient's room too long, she'd kick me or something. Like, cause again, like we're at work and we're moving. So like, if I'm like paused for 5-10 minutes, like, where do we do that at, right? So she'd give me a little kick, right? Weekends she'd be a little less chill. I could feel her a little bit more, but like I was literally remember being concerned that my kid wasn't like kicking enough or moving enough because she was chill the whole time. Obviously nothing was wrong. I had a very healthy, quick delivery, to be honest. So other than them missing my epidural, I'd had like no significant complications, but then she comes out and I'm hyper vigilant about developmental delays, right? Because again, like I know, like I'm like, okay, this milestone, okay, let's get to 2. We get to 2, we're okay, but we know certain things can happen after 2. So let's get to 5, right? So like, I was so on the developmental stuff because of my profession, right? And because of like, her first few toys, like she can only see black and white. So they're just black and white with spots for it. Like I'm super diligent about her activities and tummy time and reading and all the things. Because I also know, right, again, the importance of being breastfed early on. I understand the importance of having certain bacteria in the gut early on. I understood that, I have these first 2 years to make sure that she gets all the brain cells that she could possibly get. And right. And so like, that was my focus really. It was like ensuring the development of brain cells, because once we hit that 2, that's it. Now you gotta like live with what you produced. And then after that, like it's the pruning. So again, professionally, like I was at a certain advantage, but even still, right, it didn't give her autism or ADHD, and it didn't take it away, right? Like her brain was going to be what it was going to be, right?
Exactly.
When people want to say it's related to trauma, like there was no trauma. Like she has had a very privileged life.
That's right.
Like,
and that's
I was a pampered wife. Like I worked, yes, but like there was no significant trauma unless working is traumatic, right? But like no, there were no stressors to that extent.
Yeah,
right?
and that's why early intervention, we are supposed to be helping parents understand and see those milestones and things, but they're not taught enough to do that, right?
It's
and
gone.
That's just it.
It's so gone from even pediatrics. Again, I'm family medicine trained, but we learn anticipatory guidance, right? I still do that. That's why I love what I do, because I can still do the things that we were trained to do, right? Still have those discussions with children and the parents about anticipatory guidance and what that should look like in diet and stooling and all the things. But that's gone, right? I mean, I would take my child annually to the doctor because I wanted her to understand the importance of going to the doctor annually, and that this is how you take care of yourself, and it's about health. And so we did it more for the practical reason, but I got so frustrated with going, and I'm just like, none of that stuff is, they may ask her some silly question about like, oh, you know, what grade are you in? Or, you know, are you reading, and what's your favorite book? And, but it wasn't the, what do you want to do when you grow up? Like I was still doing this when I was practicing for insurance companies, but, and if a kid wasn't giving me, at least 3 to 5 things, again, like for me, they're not using enough of their imagination. Like I want you to be like, I want to be a fireman. I want to be an astronaut. I want to be a superhero. Like I need to hear some stuff, right? And if I'm not hearing that at a certain age, then like, let's have some conversations. Like none of that is happening anymore.
No.
So these evaluations don't happen. Like we're not like at the basic level of like going to see your pediatrician.
When my kids were young, and it hasn't happened with my grandkids. And
doesn't happen.
I do what I do for a living, and it is still not happening.
And
like,
that's
seriously?
what a pediatrician is supposed to be doing. Like kids rarely get sick. And granted, again, parents aren't also necessarily going in for those annual appointments. And again, they're going in for maybe vaccines in the beginning, and then again for school reasons. But like just to say, here's my annual appointment. Like, what are we supposed to be talking about? What's age appropriate right now? Like, what are we like? I don't know any physician right now that even like Tanner Sages their kids. That's pediatricians, right? Like that's where you go to learn about puberty and to get your Tanner Sage and for your doctor to discuss with you and your child, like what's happening with their bodies, and at least help you prepare. Like
they're not doing MChats. They're not doing anything to do screeners. My daughter is one that is religious about those annuals, and they weren't doing it. And I had to step in, and they take my own MChat and go, I've MChatted this kid twice. And each time he's flagging and we're still fighting it with, well, let's wait and see. He's not going to be less autistic, but now I'm at the point where he is turning 3 in January and has missed early diagnosis and early intervention because he's aging out of early intervention, and yet we've been fighting for this the whole time. So still have to do all these other things where I have had to step in, and it shouldn't have to be that way.
Shouldn't have to be so hard. It
should not have to be that way. Plenty of parents like myself took my son in when he banged his head on the floor at 8, and I said, what baby is this mad from 0 to this angry in 2 seconds? There was nothing happening before this. It just came on. Oh, he'll grow out of it. Okay? Because
I think, again, we don't have real solutions. We didn't have real solutions. I think we have amazing solutions now. And then all things work together. I'm be the first person to tell you that there's never one thing that causes it. There's never one thing to fix it.
Right.
It is hopefully a multidisciplinary team, similar to like what we've put together, along with, everything else, right? I'm disheartened by the things that you say that you have to go through with your kiddos, with these schools, right? I'm in a very blessed situation to be at an amazing school. where I'm not having to go in with an IEP and prove to them that I need certain accommodations for my child, right?
Yep.
They just want the kids to succeed, and they understand that she said highly gifted school, that highly gifted children, have certain needs, right? And so they're more than willing to make those accommodations without calling it autism or without calling it ADHD, right? But we're about to get testing because my school only goes up to 8th grade. And after that, it dawns on me like, well, she might need some accommodations if I've already made them make her test by herself. I make her test by herself because she wants to be the speed demon and finish before everybody else, right?
And if so, she ends up in a school that is not okay with that, right, we're going to be fighting for that.
Right. Yep. Or they don't give her pop quizzes because she freezes.
Or they have more than a certain amount of people in her class.
And so, which she's never been accustomed to, right?
Right.
And she's never been in a normal classroom, so to speak. So again, thankful for you in that sense that, yes, and thankful for our psychologist. So again, we're going to get those evaluations now because I have to, right? But again, they're expensive, right? Yeah. And not every family can always afford to be able to do that. And so I still do think the onus really needs to be on other trained professionals who are going to see them first line. And that becomes the pediatricians, that becomes the family medicine physicians, that becomes that we have to do better in med school at training them on just the basics, or we need to have basic screenings, right? Yeah. Not just, hey, is your child beating their head against the floor, right? But what are these other things? And we've talked about a few of them. They're little, but once you start putting all those little pieces together.
Why doesn't that child mind that you poked him 4 times and he just got up
that, right? From birth, right? Let's check that from birth.
Yeah. Why? Because the only time that they ever said my son was upset with that was when he was born and they poked his foot and they said, boy, he was pissed. That's what he told me about my newborn. He had the temper from then. He didn't like that. But then later on, he was like, never felt it. She
didn't care from the beginning.
This kid fell and hit his teeth more times on the ground because he wouldn't put his hands out, that I thought he wasn't going to have teeth by the time he was an adult.
So here's another one.
Cried about it.
I think dentists are in a perfect position to diagnose, I'm going to just say neurodivergence. Before I looked at it as autism and the anxiety and the angst that builds up in ADHD. Because I always say ADHD and anxiety go together, but it goes with all of them. Mm-hmm. And so my daughter, she was 6 months, 8 months, right? Just getting her teeth. And I remember going in and sweeping her mouth out because it sounded like she was chewing glass. She was grinding that early when it literally sounded like she was crushing glass in her mouth. Yeah. I'm sweeping her mouth. She is literally grinding her teeth. Not to the point where she has bruxism, right? Which is that condition. But if I go in as a mom, because we're doing the early intervention we go to the dentist early. I'm going at 6 months, a year, and I'm saying, or even before that, because she's grinding her teeth. And again, I didn't know that was at 6 months that was what that was going to be, right? Yeah. It wasn't really until she was 18 months, 2 years old that I really saw it. But at 6 months, if the dentist was well, that's interesting. We see this in children who are neurodivergent, or these are things that you may want to consider. Maybe you should see your pediatrician. When we can see things and recognize some of these things that happen early on in certain groups of people, I think that is a perfect time. And what does it take? It takes better training on the professionals. This can't be a school issue. It's not a school issue.
Right.
People are paying a lot of money to get trained. And these are not things that are hard to do if we care to recognize it, right? But we don't see it as a problem. And I just look at how many people we could probably save from having drug addiction, or being homeless on the street, or completely losing it and committing suicide.
Right.
right? If we could recognize these traits early and get them the interventions that they need so that they understand their brains. Because again, I know what it was like not understanding what my brain was going through. And again, people are like, oh, you take the diagnosis and they don't want to give people the label their diagnosis because they feel like it's an excuse. And I'm like, if you honestly have it, and someone finally tells you what it is and why your brain has been working the way that it's been working, you don't look at that as an excuse. You're like,
relief. Oh God.
It makes sense. And now you're more apt to actually be more proactive about doing something about it than you are about using it as an excuse.
Yeah. And when you come into as a teen or an adult, you're already thinking something's wrong with you, you're broken, you're all these things. And when I can help them understand what sensory issues they're having, right? Doesn't mean that it's this sensory processing disorder that it got labeled as early on. It just means that we have to understand our bodies. Guess what? There is a relief there. And what do I teach them? How to advocate for themselves. How to say, I'm a little overwhelmed right now. I'm going to walk out of this room, and have that be okay with the other person. Right? So we need to be able to do that and have people understand themselves. It's never an excuse. I tell people that autism as a child is a reason, can be an excuse to some degree, but as an adult, it never is. We have a responsibility to ourselves to take care of ourselves, to not make it our excuse, to figure out how I can help myself. And thereby, guess what? Everybody around, it's fine, right? But if that means we have to have an accommodation because you don't like cleaning your house, or I have people that struggle with doing laundry unless someone's there, and I tell them self-care, have somebody come do that laundry. That is okay.
That is the only reason I have a housekeeper.
It's okay, right? If I'm too overwhelmed and I can't do it, I'm going to have somebody do it. Even if it costs me a few pennies and I hate spending those pennies, I'm going to do it, and that needs to be okay. But in the past, in my family, that wouldn't have been. Oh, how could you?
Yeah.
Well, I'm sorry, because that's what I need today. I'm at my max bandwidth, what they call that now, spoons. I don't have any more spoons to give. We have to be able to say that and accommodate ourselves. We have to understand ourselves. And then we have to be able to advocate for the people that are saying, oh, your accommodations, you shouldn't need that, that's an excuse. Wrong. We have things that are in our mind that have affected our entire body, our system, everything, right? And does that make us wrong? No, we were born this way. So how is it that something's wrong with us?
One of those, higher achievers, like type A personalities, needing to control, I do,
it is hard to ask for help.
It's hard to ask for help for sure. And you don't want to feel like you're not capable, because you know how capable you are, right? Like, I know how capable I am in my brain. Like, there's nothing I can't do. Now, if it's not my thing, I might not do it as well, but I'm like, I'm pretty capable, right? And so when it comes down to housekeeping, domestic things, that is not where my brain wants to be. And if I do get into cleaning, I will clean so meticularly, right? So that I've wasted so much time and not done the other thing. So that is why, right, I call having a housekeeper, from the time I could afford one, right? It went high on my list, because folding clothes feels like the death of me. Right? Sheets. Because you've convinced yourself there's so many other things that you can do with your brilliant mind, things that you could put your energy to. But that is a societal expectation that has been passed down the generations. I got over it. That's what we have to realize, is that these are society things, are expectations that we're going, we have to do these things. Yeah, I gave you permission not to do those things, to know yourself, to know your limits, to say, I don't feel like it. Why don't I used to hate reading books. You know why? Because I know my brain. I didn't know this when I was young, but I know it now. If I cannot stop a story in the middle of the story. Which means that if I'm going to read that book, I better have time to sit down and open that page, and finish it all the way to however long that book is, without stopping. Because my brain will not allow me to stop mid.
Why? Well, before I might have lost my place. That's the ADHD symptoms, right? Now I know it's just because that's the way my autistic brain functions. And if I'm going to start something, I got to finish it. So it tells me you got to finish it today. Oh, the story's so good. You don't want to sit down. I can't sit down and binge watch because then I'm going to binge watch the whole season because my brain won't let me stop. Because I start, I got to turn that back
So
on.
again, that's kind of like where I feel like someone like the ADHD like overlap and starts to converge too, right? So I would say like, hyper focusing, right? Is that thing that we say, oh, that's ADHD, hyper focus. And which is why, I thought my husband had ADHD too, but he was still very different from me, right? He was way more OCD and rigid in his thing. So like
and
we're going to both end up in the same way.
Rumination, which
Right.
comes from autism.
Right. And so that's what makes
Which is hyper focus.
But it's a different type of hyper focus.
It
And so
is.
like I'm like, there's hyper focusing. And so again, is it the ADHD type or is it the autism type? And so the things that you just listed off, that's where it makes it more the autism type. Whereas so like my type, I'm like down the rabbit hole and I'm going to go here. 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 I'm like, I am going all over the place. Like it's not very rigid. It's very fluid. Probably too fluid. And then, right, the time blindness, I think exists in both, but like we'll probably both get there, but we're going to get there very differently, right? I'm going to go all over the place and he's going to beeline it right to the same spot. And it's going to take me a little longer to get there, but I'm going to get there.
But that's where that overlap of ADHD and autism make that hard because we're doing both. And imagine how difficult that is, going down the rabbit hole and then you're taking all the beelines and then you're like, oh, it's pulling me here. And then you're back to, no, I really want to do this. And and so it is like both. It's twice as hard.
So it goes back to the thing that I say, again, neurodivergent is, finding that emotional currency, right, to help move the needle for them. So again, everybody's emotional currency is going to be very different and it changes over time. And I think, understanding that does help reach them a lot better and a lot faster, but it's not easy. And I know my daughter's is changing, right? It was once upon a time, it was books. And that was like a big drive. Now it's not as much that, it's not completely gone, but she's aging out of that a little bit. Like it'll probably come back because it's never lost, but like now it's something new, right? It's another fixation. It's another, something, and then it changes and it changes and it changes. But the undercurrent, I think, stays the same to some degree. But like,
and that leans more on the autistic side, the constant changing. So some people say, okay, I
think it's ADHD,
but they think autism is, oh, they're gonna like dinosaurs, they'll like them forever. There are certain things they will like forever, like dinosaurs or Legos or whatever. But that's one thing that some people don't understand, that you can have an autistic that doesn't have ADHD and their taste will change. And so even in the ABA world, you have to have, I had what I called my Felix the Cat black bag of magic tricks, because that changes so quickly. You've got to be prepared to pull the next thing out that they're going to go, heck yeah, that's what I want. So for autism, it can change that rapidly to where we're like, yes, we love this. And then we're bored of it. And then it's like, oh, I love this.
And I'm going to put that in my ADHD category, right? And so it's just like, again, here's that overlap of like, again, having multiple interests, jack of all trades, that kind of thing. I think also why I fell into family medicine, because I could do all things and just, stick with the things that I really liked, but still be exposed to everything. Because if you just give me one thing, I'm gonna be bored out of my skull.
That's why I chose CPC.
Which again, right, that to me, is how I differentiate sometimes more autism versus ADHD. Like, whereas I could compare my husband because he was way more on the other side, is that he could eat the same thing over and over again. Boredom will set in too quickly for me. Like I just can't. Like I have a problem feeding myself day to day, right? Because again, it's like, well, what do I want to eat? Or it's too late. I'm not gonna eat anything, right? Whereas to like, again,
that's that more rigid. But I see that more in the ones that struggle to see past themselves.
Oh yeah,
but definitely, we see that. But as far as special interest in an autistic person, even if they didn't have ADHD, it changes almost with tides, and we could be stuck on something for a very long time,
and then
all
it'll
of a
switch.
sudden it just switches.
Yeah, and I get that.
And
but
then
like for
something
like
new.
ADHD, I think it's definitely, you don't get that stretch.
Right. But I'm
Except
talking
unless if it's your personal
for
interest.
little
you do.
kids. That's when you see it the most, where they're switching, and it's on. You got to be quick on the fly, right?
Well, she'll like strawberries for a little while, then all of a sudden don't like strawberries, and then
Yeah, but
come
I'm
back.
talking in the same. It could be in the same training thing that you're doing, any kind of trials or anything. It'll change that quick. They may love this, but if 1 week it's Legos and then you come back and you're thinking Legos, and then their brain is going, nah, I moved on to something else. You're like, oh shoot, now I got to be prepared.
Of course.
So you got to come with all of it, right? And so that's where like ABA gets difficult, because you have to be very like flexible.
And that's it. And
right?
I feel like I still feel like that's probably gonna fall more in that ADHD category, because again,
and it could.
I think the autism has more of the rigidity, and the ADHD is a lot more fluid like that. I don't really just, again, like, so I'm even thinking about Naya, and I'm thinking about more about myself. Like I am, again, boredom sets in pretty easily. I think that's probably more ADHD. Again, depending on what that thing is. So if it's the thing that they love, I think they stay passionate about that. It can change up a little bit. But again, like I can go in, like she likes Legos 1 minute, but then she still likes Legos, but it's something else in Legos, right? It's not like something completely different. And then Legos has transitions to like Minecraft, Roblox. So she still likes that building aspect, which is why I say, I think there's something fundamentally about the trait. It may not be the thing so much, but whatever that emotional currency is, it lives in that thing, but it may not necessarily be that thing.
Right.
And so you'll like, I think sometimes that's the hard part, because it's like, oh, it seems like it's Legos. Well, maybe it isn't Legos. Maybe it's something else, right? Maybe it's a building. Maybe it's like whatever that other thing is. She's gonna find it in something else, I think, and that's where their emotional currency lives, right? And it can be varied. At this point, right, I'm like, okay, we have talked a lot. We basically took a conversation about like what autism is and isn't,
and how the system was broken and failed us. Right?
Various rabbit holes. Not really. I think we've kind of like stayed, but we've we've shared a lot about ourselves. Yeah. We've talked about like, again, trying to shed some light on like what is autism. I think we'll both agree it's a spectrum. It is not the same in everyone. Yeah. It's gonna look different. I think what we do agree on is that, we have to do better as a society with evaluating children early. And what that needs to look like in the professional settings where people are paying lots of money to get training, to ignore a whole group of people who could be served much better if we had just simple tools, just like we were able to develop simple tools for depression and anxiety. There's screens. We're not saying you are depressed, but we're screening. Why can't we do better with screening? No, we can do better, and we're going to do better, right? Yeah. With screening for autism, ADHD, neurodivergent. Forget putting a label on it early on, it's fine. But can we screen for neurodivergent so that we can now be on the lookout for all these other particular traits? Because again, it can be cute, right, in the beginning to be stubborn, right? It can be benign to be mean to your best friend because you're trying to have control, right? Because they don't do something that you like, right? You're just, partial mean girl or whatever it may be. Right. But had we known early on when I wasn't crawling normally, that, hey, this may be a sign of neurodivergence. Let's not call it highly gifted, right? Because again, that is ignoring all those other traits that are going to be problematic for me. Right. That we need to be on the lookout for. And again, it's varied. So for me, it's not about giving them a diagnosis early. It's about understanding these traits when they pop up and being able to constantly screen to see what traits are being shown so that we can actually put things in place to help get them more towards the middle early before it becomes a problem. right? So if we start to see some of these early ruminations, fixations, rigid thinking, like stubbornness that goes beyond like norm, like you don't wake up in the morning and you're okay. Like I wake up in the morning and I'm just fine, right? That other person's still holding a grudge. Like that's not normal, right? That's not okay behavior. That can be pretty bad. Again, like certain behaviors will turn into, again, for me, it's the depression and anxiety and the things that are going to make them turn to drugs or to suicide, right?
So I think what I would challenge in that is let's not say normal, because then abnormal is the problem, right? Is what we're saying. And that's always been that in the mental health world anyway. It's abnormal behavior. That's the problem. And that's what defines what is a behavior and what's a disorder, is how abnormal is it to society. Right. And that's in the psychological world. That's in the mental health counseling world. That's how we see it. Right. So these are not people to be fixed. We want to help them where we can help them understand where they can understand, and kind of fix society, so to speak. Right. We want to, if it's something about swelling and it's something that we can prove in the brain or the body that we can alleviate that to make it easier. Yes. But so many kids are coming in and everybody's trying to fix them. And that's what starts that self-esteem issue, right?
But that's because we haven't identified those traits early enough.
Right.
Right. And my thing is, again, we've identified some things like, again, how a woman carries their child, like how that child comes out, how they're responding to the world when they come out. Like these are some early signs that we can say, hey, you know, as the pediatrician, as the dentist, right? As a family medicine physician, like when we know that we are having early traits, right, of neurodivergent, right, now maybe we can hone in on the gut more. Maybe we can hone on brain more. Like maybe we can start some of these earlier interventions so that we now, as parents and as professionals, can give them the freedom to be themselves.
Because we've got to recognize the sensory sensitivities.
Who you are is uniquely you, and no one's trying to change that.
Right.
But you have to be able to operate in society. And if what I want to see is us recognize what those traits are and help with those traits so that they don't become pathologic. Because again, what may be okay now can be the difference of not knowing what that really is. And that person ended up killing themselves, and everybody wondered like, well, why? They were just okay masking the other day because, again, no one knows what's going on inside. Right. So for me, it's early intervention comes from early recognition and being able to then, you know, put into dentist's office and into physician's offices these, you know, screens, right? We do it for depression and anxiety, but we wait late, right? That comes late in anticipatory guidance, right? Like, now when they're like preteens and adolescents and hormones are going on, when we could have recognized that this could have been a problem earlier.
Yep. Agreed.
Right? So.
And that's, I think, what you and I are setting out to do.
Yeah. Like, I don't want to say, I don't subscribe to, you know, it's a disability to the point where like you're not capable of having a successful life and taking care of yourself. Like, I don't, you know, I've seen that too. And, you know, I'm not having that, right? Yeah. We're going to push towards the middle. Like, but I do understand that those people are stuck and they're rigid. And like, again, TMS is a great way of like helping, you know, move them past that rigidity.
A good way to look at it is right now. You're not feeling capable or able to do it right now.
But we can get there.
We can get there.
So on that note, we are going to conclude our first episode of Neuroreal. And we will be back with more conversations about what it looks like, what it means to be neurodivergent. We'll talk more about our own personal lived experiences, and we will start talking more about what we can actually do about it.